The Climate and Health Declaration aims to increase awareness of the impacts of climate change on public health, to increase civic engagement on climate action in Kansas, and to advance policies that build community resilience and safeguard the future of our state. This presentation provides an overview of climate change in Kansas, including the public health impacts of climate change. The latter half of the presentation covers the main points of the Kansas Climate and Health Declaration and ways you can get involved. The Climate and Health Declaration is powered by the Climate and Energy Project with broad support from organizational signers. CEP is a Kansas-based nonprofit that has largely focused on the economic benefits of renewable energy and energy efficiency as solutions that work for Kansas. Our mission has expanded in recent years to address the impacts of climate change on public health and solutions that build community resilience. We do this work through the Kansas Wealth Partnership, which collaboratively identifies opportunities to reduce risks and increase resilience in the face of a changing climate. Reducing climate risk positively impacts our state's water, energy, air, land, transportation, and wealth. CEP and our wealth partners came together and put forward the Kansas Climate and Health Declaration in 2019. The Climate and Health Declaration continues to gain broad support from over 650 individuals and 43 organizational signers. Today's presentation will cover the ways climate change is impacting our state and our health and what we can do about it. Temperatures in Kansas, the orange line, have risen about 2 degrees Fahrenheit since the beginning of the 20th century. This National Oceanic and Atmospheric Administration, NOAA, chart shows 2 projections for temperature change in Kansas under 2 scenarios: lower emissions in green, higher emissions in red. Under the lower emission scenario, the coldest years would be about 2 degrees Fahrenheit warmer than the long-term average. That's our best case scenario. The higher emission scenario projects that the hottest years will range from 6 to 15 degrees Fahrenheit warmer than the long-term average. The good news is that the things we can do to slow this temperature rise and reduce emissions are also things that result in cleaner air and water and overall healthier communities. We'll talk about that a little more at the end of the presentation. Here's a quick 30-second breakdown on climate change. Energy from the sun comes to Earth in form of light. That energy is absorbed by the Earth and warms it. Some of that energy is re-radiated from the Earth in the form of heat. Some of that outgoing heat is trapped by the atmosphere, which is a good thing. It has kept our planet at a stable temperature. Now, however, we have been thickening the atmosphere by filling it with heat-trapping pollution. More heat energy is trapped, and it is warming our planet at an unprecedented rate. This pollution comes from transportation, electricity, industry, agriculture, and commercial and residential sectors. As a result of this pollution being trapped in the atmosphere, global temperatures have risen dramatically. 16 of the 17 hottest years ever measured with instruments have occurred since 2001. The hottest year of all was 2016. 2019 was the second warmest on record. Where it used to be scientists and environmentalists who were talking about climate change, now the loudest voices calling for climate action are doctors and nurses and other public health professionals who are making the connections between climate change and public health. This slide from the Centers of Disease Control, the CDC, illustrates the most significant climate change impacts and their effects on exposures and the subsequent health outcomes. For example, increasing CO2 levels lead to increased air pollution, which leads to asthma and cardiovascular disease. The CDC explains that some existing health threats will intensify and new health threats will emerge. Not everyone is equally at risk. Important considerations include age, economic resources, and location. Some of our most trusted public health organizations are taking strong positions on climate change. The American Lung Association explains, from the direct impact of the temperature and weather changes to the special burdens these changes placed on the most vulnerable communities, climate change seriously threatens our wellness, especially our lung health. The American Academy of Pediatrics states that tackling climate change could be the greatest global health opportunity of the 21st century, urging that failure to take prompt, substantive action would be the act of injustice to all children. These organizations, along with the American Public Health Association and many others, came together to urge action on climate change as a public health emergency. In 2016, they released a National Declaration on Climate Change and Health that was updated in 2019. If you are curious what the Asthma and Allergy Foundation of America, for instance, says about climate change, you can read all about it on their website. In July of 2019, the Kansas Health Institute released a policy brief on health and climate change in Kansas, urging that climate change is a substantial concern in Kansas, particularly considering our agricultural industry. The report addresses specific concerns that will affect Kansans, including increased rate of cardiovascular diseases, respiratory diseases, and other chronic conditions, expanded allergy seasons and worse asthma symptoms, and increases in vector-borne illnesses. Inspired by public health calls for action on climate change as a public health issue, and informed by the Kansas Health Institute's report, CEP, along with many organizational supporters, came together to release the Kansas Climate and Health Declaration, which aims to increase awareness of the impacts of climate change on public health, increase civic engagement on climate action, and advance policies that build community resilience in Kansas. You can read and sign the declaration online at resilientkansas.org. The framework of the declaration clearly outlines the primary points of intersection between climate change and public health. Climate disruption impacts our lives, health, and economic well-being of Kansas. Climate change is a major public health concern in Kansas. Those least responsible will be most impacted and least able to adapt. Solutions exist to build resilience, economic opportunities, and healthy communities. The Climate and Health Declaration pulls data from the most recent scientific and public health reports. We relied on sources that provide either regional or Kansas-specific data or that focused on specific health risks that will impact Kansans. You can access all the resources and more on resilientkansas.org. This next section will walk through each section of the Kansas Climate and Health Declaration. Climate disruption impacts the lives, health, and economic well-being of Kansans. We face increased risk of extreme drought, wildfires, flood, and food shortages. May 2019 was the wettest month on record for Kansas. For example, Yates Center's normal May rainfall is 5.54 inches. In 2019, it was 21.93 inches. Winfield's normal May rainfall is 5.83 inches, and in May 2019, it was 19.75 inches. Such unusual rainfall amounts occurred throughout the state. Also in 2019, there were 287 National Flood Insurance Program claims in Kansas, totaling $3.78 million. But this does not represent the full extent or cost of the 2019 floods because only 10% of homes in a floodplain carry an FIP insurance. Think about the impact of the floods for the 90% of homes without flood insurance. Increases in extreme weather threaten livelihoods, destabilize communities, and drain resources. We are already seeing the impacts. By contrast to the heavy rains in 2019, 2012 was one of the 10 top driest years in Kansas. We experienced 248 weeks of drought from 2010 to 2015, with all 105 counties in drought conditions for extended periods. Kansas wildfires have also increased in frequency and severity. The two largest wildfires in 50 years occurred in 2016 and 2017, burning a combined 822,000 acres, totaling $80 million in total damages across 4 counties. Farmers, ranchers, construction workers, first responders, and military personnel will be among the first to experience the effect of climate change. It is clear that climate change is a major public health concern in Kansas. We're already experiencing longer periods of pollen production, which will continue to worsen asthma symptoms and lead to longer, more intense allergy seasons. You can see here that the ragweed season in Kansas City increased by 25 days between 1995 and 2015. As we experience warmer temperatures, the changes in the geographic ranges of ticks and mosquitoes will increase vector-borne diseases such as Lyme disease and West Nile virus. We had just a handful of tick-borne diseases in 2004 that jumped up to almost 350 in 2017. CDC research indicates that tick-borne diseases were 20 times more common in Kansas, and mosquito-borne diseases were 35% higher in 2016 than in 2004. The CDC now lists Kansas as a vulnerable state for vector-borne diseases. As the average annual temperatures increase, we will experience increased heat wave intensity and frequency, increased humidity, degraded air quality, and reduced water quality, all of which will increase public health risks. Kansans will experience increases in cardiovascular diseases, respiratory diseases, and other chronic conditions. Exposure to higher temperatures and extreme heat can increase body temperatures to unsafe levels, stressing vital organs such as the heart, lungs, kidney, and brain, and increase the risk of heat stroke and other heat-related injuries or illnesses. Hospitalizations and deaths due to heat-related causes range from a low of 57 in 2004 to a high of 180 in 2011. In 2011, 37 Kansas died of heat-related causes. Impacts on mental health include increased stress, depression and anxiety, strained social and community relationships, increases in aggression, violence and crime, and increases in trauma, shock, and post-traumatic stress disorder. The suicide rate for farmers in northwest Kansas is up 64%, higher than the national average. Climate change affects everyone, but some more than others. Those least responsible will be most impacted and least able to adapt. The American Public Health Association explains that climate change exacerbates existing health and social inequalities. Vulnerable populations will bear the greatest burden. Children, seniors, low-income communities, communities of color, immigrant communities, those with chronic diseases, pregnant women, indigenous people, and people with disabilities will be most impacted. The Lancet encourages that a comprehensive response to climate change could be the greatest global health opportunity of the 21st century. For example, health impacts from increased temperatures will impact the elderly, 16.7% of Kansans, and the very young, 6.4%. People with existing medical conditions, urban residents, and laborers working in extreme heat. Air conditioning is a primary means of reducing risk of heat-related illnesses and reducing the exposure to allergens. Unfortunately, Kansas hits low-income residents, 11.4% living in poverty, 8% of Kansans over 65, with a 1-2 punch with the highest electricity rates in the region and no hot weather rule to protect them from the extreme heat. As a result, air conditioning is often an inaccessible luxury for many Kansans, especially those living in areas most affected by racist housing policies like redlining, the very same communities hardest hit by climate change. Fortunately, solutions exist at all levels to build resilience, economic opportunities, and healthy communities. There are many health benefits of climate action. Our first step is to protect Kansas water, energy, air, and land resources by preserving and restoring water quality and quantity, prioritizing improved air quality, protecting native ecosystems, wetlands, rivers, and streams, improving soil health, and supporting local food systems. More Kansas farmers and ranchers are protecting soil health, which improves water quality and quantity, air quality, and reduces need for high energy and water intensive practices while also sequestering carbon. We need to reduce emissions from electricity generation, transportation, and agriculture. The Kansas wind industry has made big impacts in this area. We've gone from 1 wind farm in 2007 to 38 wind farms today, with 2 more under construction. Kansas leads the country with nearly 45% of our electricity from wind, which leads to reduced emissions. Kansas has as much potential for solar as we do for wind power. We're just beginning to see how utility-scale solar, community solar, and rooftop individual solar can help communities create their own clean energy. As solar power continues to come down in price, we can see the same growth from solar that we saw in wind, both in energy generation and economic growth. As much as we talk about renewable energy, our first step should always be affordable, energy-efficient housing, which provides more protection from weather extremes and saves energy and money while reducing emissions. As electricity rates continue to go up, we need access to programs that help Kansas save energy. Lowering the amount of energy we waste reduces pollution and means big gains for health. Pollution from fossil fuels contributes to 4 of the leading causes of death in the United States: cancer, chronic lower respiratory diseases, heart disease, and stroke. Many states are adopting low emissions fuel standards to help reduce emissions and drive the electric vehicle markets. Expansion of the energy efficiency and alternative fuel programs play a huge role in improving the lives of Kansans by building a strong local economy, reducing emissions, and reducing health-related impacts of climate change. To face the climate and health impacts, it is imperative that we secure and increase access to healthcare for Kansans across the state. This map reflects health outcomes across the state, with darker colors reflecting worse performance. Climate action is needed on all levels, and we need to learn about the solutions that work in Kansas. If you need help, invite CEP to present a Mapping the Connections workshop for your church or civic group. We can all take action in our homes, organizations, and communities. We need your voice and your actions to address the climate crisis. Stay engaged in climate action, encourage your friends and family to register and vote, and get involved in the solutions we've outlined today. Encourage everyone to sign the Kansas Climate and Health Declaration. We also encourage you to consider signing up as a climate and energy voter ambassador to help engage your friends, family, and colleagues on climate issues. Make sure your friends vote. Climate issues are always on the ballot. Encourage them to run for office. Talk with your legislators about climate change. Encourage your elected officials to adopt state and local climate action plans to set a deliberate course for our future. They represent you and your community. By signing the declaration, you are declaring a commitment to a healthier future for all. You're letting your elected leaders know that you encourage them to stand with leading public health organizations, and you're making a clear call for them to address climate change as a public health threat. This declaration tells Kansas decision makers that we want bold, comprehensive action to reduce emissions and build resilience in our communities to reduce the risk of climate change and safeguard our state. Here's what you can do. If you represent an organization, you can encourage them to sign as an organizational signer. We currently have 43 organizational signers, and more come in every day. Organizational signers are encouraged to adopt an organizational statement on climate change and public health, like this one. You can read them all at resilientkansas.org. Sign the Climate and Health Declaration as an individual. Share it with your friends and help spread the word. Commit to securing additional signatures. Express your concerns about climate change and public health to elected officials and even to your family members and neighbors. Vote on climate issues. Write letters to the editor in support of action on climate change as a public health crisis. We have templates to help you. Host a signing party in your community to help gather more signatures on the declaration. Register to vote. If you're committed to taking an even bigger role, but feel like you could use a little help, let the Climate and Energy Project support you to attend high-quality leadership trainings at the Kansas Leadership Center through our Kansas Environmental Leadership Program. You can also donate to the Climate and Energy Project to support the distribution of the Climate and Health Declaration. Declare your commitment to a healthier future for all. Please sign the Kansas Climate and Health Declaration today. Thank you.